Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM and WUFO 1080 AM with your host, Francesca Messiah, Manager Workforce Development from Kaleida Health. As you are aware, the show is an hour. So the first half hour, we will be speaking with Dr. Selleck, who is Dr. John Selleck, who is a hospital epidemiologist, along with professor of medicine, Division of Infectious Diseases for UB. Our topic will be we'll be discussing the new COVID vaccine, flu RSV vaccine. And our second guest, starting at 7:30, will be Dr. Fred Archer III on a part 2. He was just on 2 weeks ago. However, this week, Dr. Archer, pediatrician, will be discussing preparing your children for school. School has begun, and we just want to make sure your children are immunized, and also talking about different immunizations, different things, different health topics for your children. Well, Kaleida Health. Who is Kaleida Health? I know I say this every week, but every week I always have my friends in the community who really aren't too sure all that we represent. Kaleida Health is over 12,000 employees, and we're Buffalo General Hospital, Oishei Children's Hospital, Miller Fillmore Suburban, Gates Vascular Institute. We have a laboratory division on Flint Road. We are DeGraff Emergency Center in North Tonawanda, visiting nursing association that are available for home visits, all ages, 24 hours a day, 7 days a week. Great Lakes Cancer Care Collaborative, General Physician Network. Those are our physician practices located again throughout the community. Many are on bus lines for your full medical needs. Family planning. We have women clinic. We have 2 women clinics here in Buffalo, and we have clinics not only for women and men. We have clinics for all adults, children, and we have clinics for specialty services such as cardiac, such as rehab, and all of our locations. We have locations throughout Erie County. For details on our locations, please Google and visit KaleidaHealth.org. And when you go to Kaleida Health, you'll see, and you'll press on locations, you'll press on services, and all this information I said will come up. Also, we have over 500 open positions. So if you're interested in a career change, or you're interested in a job, beginning with a high school education, and you have to be at least 18 years of age. For more information, please visit KaleidaHealth.org. Click on Careers at Kaleida. Well, moving on with our program, we have a reoccurring guest, only because he's excellent. And he's the expert. He's an expert. And that is Dr. John Selleck. Good morning, Dr. Selleck. How are you?
Good morning, Francesca. I'm good. How are you?
Oh, wonderful. And Dr. Selleck, I just want to again mention our topic for our listeners, who I'm always so glad they're listening. And it's new COVID, because we have a new COVID vaccine. Also talking about the flu vaccine, RSV, and are they effective? So, Dr. Selleck, can you please just briefly describe, because you are an epidemiologist in the hospital. However, if you could just give us a brief overview for those who may have forgotten, what is an epidemiologist and why are they in the hospital?
Yeah. I'm an infectious disease doctor by my primary trade. And within that, we see many infectious disease docs do different things. Some of them do laboratory research. Some of them do antibiotic research. I do what's called hospital epidemiology, which is tracking the infections that occur in the hospital, sometimes the result of medical care, sometimes things that people bring to the hospital that can potentially spread to others. And obviously, it's not just tracking them, but we want to prevent them. So it's really, preventive medicine is what we're looking at. So the same way the epidemiologists out in the community are trying to prevent spread of disease, we try to do the same thing here in the hospital. There's me and there's a group of infection prevention practitioners, mostly nurses, and the other people in the quality program, where we're always looking for ways that we can make the environment safer for our patients and for our visitors and staff.
Thank you, because I was going to say also for the patients, visitors, and not only for the patients, but for the visitors and staff, because no one wants to get an infection. No one. How about well, okay, and thank you for that explanation, that description. Now, vaccines, that is primarily what we are focused on today. Are they effective? Could you just briefly again tell us a little bit about vaccines, their importance, and for those who don't always feel they're important, why are they important?
Well, if you look back at history, and for some of us, history is a little bit longer than perhaps some of your other listeners. But, when I was growing up, I was born not too long after the last large smallpox outbreak in New York City. When I was in elementary school, we routinely had waves of measles and chickenpox and other infections that resulted in, a large amount of illness. But when you look at a portion, for the last probably, half a century in the U.S., we've generally had about 4 million kids per year, entering the population. That dipped a little bit in the 1970s, the so-called baby bust. So you're always looking at 3 or 4 million people, and more than 4 million people when I was young. So if a lot of them get diseases like measles, there are significant complications like measles encephalitis that are not very common, but when 4 million people get the infection, you do wind up with some people having, very bad outcomes or even dying. So when you look at the development of vaccines that we currently use, certainly smallpox vaccine has been in use for centuries. The others are much more recent, since the 1950s and 1960s, and they have largely eliminated diseases like polio, like measles, that tend to have very bad outcomes in a small portion of patients. So we continue to do this as we get new diseases like COVID. We were able to develop a vaccine fairly quickly. Influenza flu vaccine has been available for decades now. We've, within the last few years, seen the finally have RSV vaccines in the market for both young people and adults. So it's really been quite remarkable. And the safety profile of these vaccines is remarkably good. The number of bad things that happen with a vaccine, that truly happen, not the, some of the things that you read with these conspiracy theory type things. But the number of bad things that happen with vaccines is extraordinarily small, especially as compared to the benefit that they provide.
Yes, and with COVID, I mean, we just think about what happened before we had the vaccine, or even HIV, before we had different medications and stuff. So there's such a rich history of what the before and after. And we always like to focus on the prevention and the after. Um, so why then does COVID and the flu vaccines change so frequently? Why is it every year, or I don't even know how often the COVID vaccine has been updated? I'm not sure if that's every year. It might be, because years do fly by quickly. But why do these two vaccines change so frequently?
Yeah, this is the nature of these respiratory viruses. They spread very rapidly. Large numbers of people get infected, and as all of this replication and spread is going on, the viruses develop mutations that alter the way that they attach to our like our nasal mucosa and our respiratory mucosa. So, then that has an impact on how our immune system works. So, this is why we have to reformulate these periodically. Now, our flu vaccines, again, we've been doing this for decades.
Mm-hmm.
With a flu vaccine, you need a new one each year because the strains are a little bit different. And as we've seen with COVID, even though the disease has only been around, for a handful of years right now, it has still gone through so much mutation that the strains that are circulating now are fairly different from the ones that were circulating, say, back in 2020, so that we have to come up with new vaccines that better match the strains that are circulating right now, and this is true for both flu and for COVID.
So then both flu and COVID, and I never even thought about that because I know RSV is, but are flu and COVID considered respiratory illnesses?
Yeah, they're clearly they get transmitted by respiratory droplets. So, someone gets flu, someone gets COVID, someone gets RSV, and they're coughing. Some of those droplets may get directly to a new person. It's been, fairly well described with RSV that the virus gets on surfaces. And if you handle that surface and, say, touch your eye or your nose, that you may, wind up transmitting it that way. But primarily, it's droplets when someone is coughing or sneezing, perhaps even, talking loudly or singing. If you're close enough, those droplets are, the droplets of moisture from our nose and throat and mouth that may contain the virus, then get from the infected person to another person.
That makes it so. I'm just going to ask a question. So if someone, let's say, is over, I'm just going to say 15, and they're just sneezing, not covering their mouth, do you think it's proper etiquette to ask them to turn their head or not say anything?
No, I think it's beyond proper etiquette. I think that we've kind of moved. We try to get people to think. We call it respiratory etiquette in the hospital, and we can call it the same thing on the outside. But if you're coughing or sneezing, and you don't have and you don't have a handkerchief or Kleenex or whatever,
or
coughing,
mask, or
right?
mask.
Correct. Coughing or sneezing into the crook of your arm is really the proper thing to do. So that way, anything, any of these droplets that you would, blow out, these droplets contain virus that you would blow out when you sneeze or you cough, you would now be catching them in your shirt sleeve in the bend of your elbow. That's really, I think that's just common courtesy so that, but you see it all the time when you're out in public, people are sneezing and coughing away.
Yes.
And I just go the other direction.
Yeah.
I don't want to be anywhere near them.
Yeah. And a couple of weeks ago, I was around a newborn, and there was no one coughing or sneezing, but the mother handed out masks. So if you just wanted to look at the baby, just to look at the baby, like look over the baby. She made you wear a mask. And I wasn't offended. I thought it was fine because the child was like a month old. And I know that that little baby's system is not developed.
Yeah.
So, I'm just saying to listeners, if you have a baby or even an elderly person who has a compromise or system, it's okay to hand people a mask. It's okay because you're just protecting that loved one.
Yeah.
Who should get vaccinated? And who should get vaccinated?
With we're going to talk primarily about flu and COVID. Pretty much everyone. There's no reason to not get vaccinated unless you've had a reaction to one of these vaccines in the past. So pretty much everyone, but we especially focus on people who are older, people who have chronic diseases, especially respiratory diseases. If you have asthma, if you have chronic obstructive lung disease, if you have heart failure, if you have cancer, if you're getting chemotherapy, if you have a kidney transplant, anything along those lines, those are the people that we push really hard. But basically, everybody can get a vaccine because what we typically have is this huge pool of people who are responsible for maintaining the infection. And many times those are younger people, they're in school, they don't get real sick when they get these things. So they just kind of go out and go around their business, but then they're spreading to other people who are at much higher risk should they get infected. So basically everyone, but again, the people who are at high risk are the ones that we push really hard.
Yeah, and I have a couple of friends who are in education, and they're always around students, like young students, high school students. And I, not to say I am not a doctor, I'm not a medical person, but I always recommend that they get the flu and the COVID vaccine because they seem to catch colds. And I don't know, I don't know, is it my imagination thinking if those in the education system, lower, higher ed,
No,
exposed people?
I think that's a group of people who are prime candidates for vaccine because then they're in close contact with with kids who are especially prone to maintain spread of these viral infections. My wife and I just traveled recently for a family event, and I was thinking of the desk people at the airport at the gate. Every time they're filling up a plane, you've got maybe 100 or 200 people who are walking by you, and so I think that you really, like I said, everybody should get vaccinated, but we know that not everybody does it. But I think particularly when you're in these settings where you're having contact with large numbers of people, that should be, a little extra boost for you to get these vaccines.
And you know what? I have to tell you, I never thought about the people who scan your tickets and such or anybody in the airport. That's an eye opener. So if someone received the vaccine in 2023, the COVID or flu, is it necessary to get it again? And I guess another way of saying that question is, how long does a vaccine last in the system?
Yeah, those are key points. The two things that play into this are how long the antibodies last from one of these vaccines, and the answer is several months. Probably about 6 months on average. And there's variability. Plus, we have this problem, of these viruses mutating regularly. So that's why even if you had the vaccine last fall, the new formulation for the COVID vaccine is out. The new formulation for the flu vaccine has been out for probably at least a month. So Both of these are new formulations to better cover the strains that will be circulating and to give you that boost of antibodies that you're going to need to get through our respiratory season, which, again, usually runs, at least until March. So what we always like to tell people, by Halloween, you should have your vaccines. So that way you're covered, from whatever part of October, hopefully through about March, which is the peak time for spread of these viruses.
I know this question could sound strange. So if someone has gotten really sick, so they've had the flu virus, but they got, but they've gotten like a really bad cold, and they've gotten a couple of colds, and it hasn't been within a year. Can they get another one again, or if they were to receive another vaccination, it just wouldn't do anything for the system? What should they do?
What, you get another one, another vaccine, or
Another vaccine? Should they? So let's say they get a couple of bad colds. Should they get another vaccine or not?
No, remember, the flu shot is not going to help you against the colds. Colds are caused by a different group of viruses. So, what we're looking at is we tend not to, in the Northern Hemisphere, we tend not to have very much flu in the, say in the, April through September, October range. It's the exact opposite in the Southern Hemisphere. So Australia is just now coming out of their flu season as we're going into our flu season. So, the number of colds that you have really has nothing to do with whether or not you get these vaccines. You're really looking to do everything you can to either prevent influenza or COVID, or if you don't completely prevent it, you're going to make the disease much less severe by getting vaccinated.
Mm-hmm. Yeah. And I also want to say that if you're, I guess similar with wearing a mask, if you are in a household, if you're in a, multi-generational household with an older relative and a young relative, if talk about that. I'd rather you talk about that. If someone is living in a multi-generational household, what would the recommendation be?
Again, everybody should get vaccinated. I would, especially in that setting, want the older person to get vaccinated against flu and COVID. But I think this is perfectly good reason for the younger people to get vaccinated as well, because if they don't bring it home, or if they do get infected and they're not as sick, then they're going to be less likely to transmit it to the riskier person in the household. And this is why you saw back during COVID there was so much emphasis on nursing homes and making sure it was safe, because you bring visitors in, especially if kids want to come in and see grandma or grandpa, and they come in with an infection, something that's an annoyance for a 10-year-old kid could potentially be fatal for 70 or 80-year-old grandma or grandpa. So I think that everybody should get vaccinated, but there are groups of people where we would really push harder to make sure that they get it.
Now, and for the 15-year-olds, would they visit their or contact their pediatrician for that?
Sure. These vaccines are now widely available. So I always like it when things are done with the primary care doctor, either the pediatrician or a family medicine doc or internist. That's best. But the many workplaces will offer vaccination, and most pharmacies now offer these vaccinations. So we've made it progressively easier over the years to get vaccinated. There's really not much excuse anymore. Like I said, they're widely available. I read, a quote from you know, someone high up in the food chain at Walgreens, and they said that they would have the new COVID vaccines out in their pharmacies by tomorrow. So even if it's not all by tomorrow, it'll probably be by next week. And
Mhm.
the flu shots have already been available. So, I think anyone listening to this the first weekend of September,
Mhm.
by the time you hear this, these vaccines, they should be pretty widely available.
Mhm. Now, are they going to have, I know last year, 2023, they had I called it the combo, where you could get a flu and a COVID vaccine. Do you know if they're offering the combo vaccine this year?
Unfortunately, it's not going to be available this year in a single
Oh,
shot. We're hoping for next year. We were hoping for this year, but Pfizer announced a couple months ago that they would not have it ready for this flu season, but they were hoping to have it ready for the 2025 flu season. But people can get both of these at the same time. There's no problem getting the flu shot in one arm and the COVID vaccine in the other arm. So you can make it one trip to your doctor's office or one trip to the pharmacy and get both of them.
any tips on if you have a sore arm after that?
It's very variable. Most people will have a little bit of soreness. To me, that's a very small price to pay
It
uh,
is.
to avoid getting the flu or getting COVID. So, I never let that be a determining factor.
Mm-hmm. Now, because we have a couple of minutes left, I know when I was a fellow in the with the New York State Department of Health, I studied epidemiology, so I have an understanding for it. And found it very fascinating from the research end. What got you into epidemiology? What made you go to that route in medical school?
I always liked it. Going back to when I was in graduate school in microbiology, one of the first courses that I took my first year was epidemiology and the history of the diseases that have afflicted humans, and in many cases changed the course of history. You look at the Black Death and the 1918 flu and smallpox. Those are just three prominent examples, but there are many, many other examples of how infectious diseases changed history at many different points. So, the more I read about it, and in general, for instance, when I took my first bacteriology course and then my first virology course, there was always discussion of how these diseases, at one hand, for someone who does research in a lab, you really like breaking it down. What is it, inside these critters that make us sick? For
Right, right.
me, it's the bigger picture is more important. How do they spread? Why do they spread? What are the things that increase the spread? What are the things that we can do to stop the spread? I found that to be, I'm still interested in the other part. What are the toxins, or what genes are causing what bad features of these bacteria or viruses. But I really like looking at how these various organisms are spread, and then how we respond to their occurrence in the
Right.
community.
Yeah, well, and the next steps. Well, Dr. Selleck, I know you will be back on the program again, but I want to thank you for being our guest this morning as you shared with us information about the new COVID vaccine, the flu vaccine, and some information on RSV. So I want to thank you for being our guest this morning on the Great Lakes Health Radio program.
Thanks, Fran.
And now on to part two. Good morning and welcome back to the second part of the Great Lakes Health Radio program with your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. Well, 2 weeks ago, we had a guest on the program, Dr. Fred Archer, when we were talking about maternal and infant mortality and morbidity. Hate to use that word, but we were. And I said to Dr. Archer, we're going to have a part 2. And you know what? I have Dr. Archer. We, not I, we have Dr. Archer. Good morning, Dr. Archer. How are you?
Good morning, Fran. Again, how are you this fine day? Glad to be back with you.
Wonderful. And I just want to mention Dr. Fred Archer III is a clinical assistant professor at the UB Medical School, and also he is a pediatrician at the Niagara and Broadway pediatric clinic, part of Kaleida Health. And I just want you to also know that today's topic with Dr. Archer, we're talking about getting your child ready for school. That was something that came up 2 weeks ago when we talked about making sure your child is ready for school medically. Because earlier today we talked about other medical topics. So Dr. Archer, the first thing I want to ask, and why did you choose the field of pediatrics, and how did you get started?
Well, I chose pediatrics because my homework would end up being watching cartoons and playing with Legos. Just kidding. That is part of it. That is part of it, but not the main reason. The decision for pediatrics actually started when I was in medical school. I was one of those nerdy kids, like, I want to be a doctor. I don't know why. That was just a jam for me. My family's always been kind of a service-oriented family. You've got to give back to your community. And this just felt like a really good way to do it. But when I went to medical school down at the Howard University College of Medicine in Washington, D.C., you go through like all the med students, all your different rotations. And when I did my pediatrics rotation, I found that I looked forward to going in every day. I really enjoyed what I was doing. I enjoyed the interaction with the other doctors, the nurses, the providers, and the interaction with families and kids. It was not just professionally, but personally fulfilling. And then when I went home, I looked forward to going back in the next day again. And so when you go through med school, some people are lucky enough to know exactly what they want to do when they go in. The rest of us find it when we're there. But it just really kind of resonated with me that this is the best way I felt I could serve. This was really the best way I felt I could use, my gift for being a giant goofball, but also take that and deliver health to a family. And one thing that really humbled me that I learned in medical school is that there's nothing more precious on the planet to somebody than their children. And to be involved in the care of somebody's child is a very humbling privilege to be allowed to be part of. And if I could be part of that, well, wow, that's amazing. So it just kind of really hit me in that fashion. And after medical school in Washington, D.C., I came back home and did my pediatric training at the time, Women and Children's Hospital of Buffalo, now the Oishei Children's Hospital. And it was really nice to be able to leave, but then come back home and take care of your own community at home. That was a wonderful thing to do. And now I'm here, ain't going anywhere anytime soon.
And you know what, Dr. Archer, I have to say one thing I always tell people when they say something that kind of does an aha moment in me. I always say that could be a good title for your book. And there's nothing, and you just said nothing more special than children. That could be the name of your book.
Okay, well, I gotta give you some royalty rights now for the naming.
Oh, that's okay. Just my name. Talking about pediatricians, you are African American. You're
Yes,
a pediatrician, but you're not the first. I mean, I remember my pediatrician, although I hated getting shots, was Dr. Lydia Wright. And Lydia Wright, there was a school right here, Buffalo Public School, named after her.
Not just Lydia Wright, the Lydia T. Wright School of Excellence, school number 89.
Lydia T. Wright School of Excellence. That's right. Oh my gosh. Sorry, Dr. Wright. Who are some of the other giants of African American pediatricians who have served our community and our children?
And so if you're talking about if you're talking specifically pediatrics, Lydia T. Wright was the first. And that is why, being the trailblazer that she was, there is a school named after her, because people just being able to see her, not just as an African American, but an African American woman in medicine, in the field, in the community, was just game changing. And that's why it's important that there's a school named after. There was Dr. Leslie Clapp from Maine Pediatrics, who was a legend. That woman knew her medicine, and she mothered those children, mothered those families, which my pediatrician growing up was Wayman C. McCoy Jr.
Oh my gosh, Dr. McCoy, yes.
Dr. McCoy, and he was here for 12 million years. And I had the good fortune when I was in my training to actually have patients of his when I was a resident. So it was a little surreal. I felt like I was getting examined again. Like, okay, gotta make sure I'm doing right, because that's Dr. McCoy. He's going to call my parents if I don't do right. But again, just seeing that my doctor looked like me as a kid, I'm sure on some level was impactful. I would be remiss if I did not mention Dr. Luther Robinson, who is recently retired. He was a professor of pediatric genetics at the Children's Hospital of Buffalo for forever. And when we say genetics, nowadays it's microdeletions and thin film ellipsometry and these very, very fine, tiny microscopic details people are looking at. But he came from that school where he could just look at you and know, based upon the physical features, this is most likely what your genetic disorder was. And 99 out of 100 times he was right on. Man was brilliant. And to see an African-American professor of pediatrics was inspiring to get to work and be trained by. But most importantly, I have to mention who I called my pediatric big brother, and unfortunately he's no longer with us, Dr. Jonathan Daniels.
Yes.
Who was, when you talk about people that walk the talk, there's my wife and there's Dr. Jonathan Daniels. Okay.
Yes.
And Dr. Daniels was from Buffalo, trained in Buffalo, was in the community of Buffalo. He finished up his pediatric training at Children's Hospital Buffalo before he became a practicing physician, right before I started my residency program. So as soon as I got here, he saw me, he's like, bam, I got you. And he mentored me the entire way. And seeing someone so close enough in age also to really look to for how I should conduct myself, how I should practice myself, and what that meant for the community. He took that responsibility very seriously. And to this day, there are still people, there's still families, there's still children that are doing successful, that are thriving because of the work he did, just as a person in the community. And the most important thing about all of those folks, they didn't do it for accolades. They didn't do it because, oh, hey, I'm going to get all this great stuff out of it. They did it because it was the right thing to do for the people. It was, it's to serve the community you came from. And if another small child saw that as a possibility, all the better, all the better. And that's one reason why as a pediatrician, affiliated not just with Kaleida, but we're also affiliated with the Jacobs School of Medicine and Biomedical Sciences. And we're always looking to the future. And so one thing that is a mandate from the medical school is we want to maintain a diverse class that represents the diverse nature of the city of Buffalo, so that all communities, urban, rural, suburban, have representation, have someone that they can see that makes them go like, that's something I could do. That's right. That's something I could be. And it's just as important for that little kid down at Frontier High School out in the boonies as it is for the kids that are going to McKinley, the kids that are going to Cleve Hill, the kids that are going to school in the city here. I love that there's a commitment for all groups to be represented. That's a huge thing. That's a huge thing.
And and you see kids on these, well, I guess young children, older children on their computers or iPads. I wonder if there's a game, right? They're always playing games or something. I wonder if there's a game called Taking Your Steps to medical school, or is this for you? And if you check this and you move on. The other day, a 8-year-old explained one of the games to me, because I don't have children. I love children, but she explained the game to me. I forgot what she was playing, a reading game, Find the Elephants or something, but you just made me think, I wonder if there's some type of a game for children called Careers. I'm always talking about careers. And if there's a game on careers, check this. You may be interested in that. Check that and it takes you through different careers, including careers in medical field. But anyway, that's another topic.
Well, I should laugh. There was a game eons ago that we used to play that was an appendectomy simulator. So you
Oh my
you learned how to,
gosh.
and yes, it was a game, but you went through, oh, this is how you diagnose it. This is how you treat it. This is how you would do the surgery for it. And there's multiple games like that that still exist, which give kids that kind of flavor. So this is using the technology we have for good and not for evil. And so there's a lot of things out there that kind of stimulate the kids' interest. But the best way to do it is for them to see people in the community that look like them.
Yes, yes.
From every background. I don't want to leave anybody out.
Right.
And I think this is good for everybody.
Yeah.
Which is why I'm not going to throw names out there, but we have a couple of really fantastic residents in our program that might fit that mold for our community right here in Buffalo.
Oh, wonderful. Well, on with the topic of the program, but I just wanted listeners to hear from you from the heart. Getting ready for school. I know recently I was visiting my dietitian nutritionist, and there were all these little kids coming in and out of the building with their parents. And I was thinking, what in the world is going on? And I thought, oh yeah, Fran, it's school kind of things that that parents need to, if they haven't done it yet, that they need to be mindful of, and for children to start at school. So let's start at the youngest age. Let's say your child's going to preschool to your child's going to high school. Are there different types of things parents need to do to prepare their child for school?
Fran, yeah, we're in the middle of that right now with our clinics.
Okay.
Because this is definitely the time where if you didn't get it done already, everyone's coming in to make sure their kids have an updated physical and making sure all their immunizations are up to date. Because if you don't, So if you do not have your immunizations up to date, you will get a letter and a phone call, and they want to make sure that you've got those up to date so you can safely have your child in school. And there's different ages and stages where we do have certain required vaccines. And full disclosure, I'm a pediatrician, gone to med school, fully believe in the fact that, vaccines work. That's why we don't see those illnesses that much anymore, because we've done such a good job vaccinating. So what the biggest step is that first set right before kindergarten. That's where you get that MMR, the measles, mumps, rubella, and chickenpox. You got to have that before you enter kindergarten, along with the last set of your diphtheria, tetanus, and pertussis and polio. Those are all 8 of those things are actually only in 2 shots, which is kind of nice. It's not like you're giving a kid 9,000 pokes. And those are usually given to age 4 so that the kids have them in time for kindergarten.
So quick question. So if someone is taking their child, they've gotten all those immunizations, and we're all busy. And let's say the mom has needs to go grocery shopping, needs to make a stop. Is it good to take the child home to rest? Or is it okay to take the child with you to your next 4 or 5 things that you need to do on your list?
I always say it depends on the individual child. But it is okay if the kid's feeling all right, you can take them along to their next stops. A lot of times, some kids, the arm will be sore. In rare cases, some kids will develop a slight elevated temperature, maybe 99 degrees, maybe 100 degrees. Nothing wrong with them having a little Tylenol or Motrin in the evening after they get their vaccinations. If they're still complaining of a little soreness, have a low-grade temperature. The temperature does not mean they're sick. It means their immune system is actually turned on and is now starting to make antibodies against the things you are getting them to protect their body against. If it's a week later, different conversation. You do want to be talking to your physician at that point. But within 2 to 3 days following vaccinations, if kids got a little low-grade temperature, that is part of the process of your body making those antibodies. So if the kid's feeling okay, and this is the only time we advocate this, if you got your shots, you can stop by Dairy Queen, get an ice cream cone, stop by McDonald's, get a small fry, just because you got your shots that day. Otherwise, we do not recommend fast food.
Okay. So you talked about so I'm new to this country. I'm coming to I'm in the US getting ready to start my child in kindergarten. What if I'm not sure if my child has been vaccinated in another country? Then what happens? Does a child then receive the vaccinations?
When in doubt, we will restart things. And it's not because we want to be giving kids things they've already received before. As much as possible, we ask for parents, even if they're from different countries, bring the records with you. If you've got a family member there who knows where those papers are, have them take a picture and send it to you through their phone if you're able to do that. But there's some people we know, they had to get out of Dodge quick. There's
Right.
things going on around the world where people left for a reason, and came to
Yes.
this country so that they could have that better life and better chance and better start for their kids. So if they don't, just to make sure they're prepared for school, we make sure they have the minimum requirements that are needed for school. And we do have catch-up schedules available. And if the schools have a concern, we make sure we write appropriate documentation for that family saying, we know this kid is not from here. We know we're restarting the series. Here's the schedule we've got them on to get them caught up. And the schools are usually very good about accommodating and making sure, oh, you're on the schedule, you know what's going on, you're in communication with your doctor, here we go.
And how about TB? Is that still something that all children?
Well, we no longer say TV specifically, we do say electronic entertainment, or what we say non-educational electronic entertainment. The current recommendation usually is no more than 2 hours a day of non-educational electronic entertainment. My dad used to say we'd just sit down in front of that idiot box and just let our brain switch.
No, I meant TB shots.
Oh my goodness, tuberculosis.
Tuberculosis.
I apologize for that because again, now TV is still a thing, education thing. We want the kids to get out and get exercise. But when we say tuberculosis, that's actually a very interesting side topic. In the United States, we do not routinely give a tuberculosis vaccination. Okay, just because of the endemic background rates of what we normally have here. But in other countries, because the rates are different, there is a TB vaccine that some children do receive. So it's not a routine. So you might be thinking, of course, though, of the tuberculosis testing that we do,
right.
The PPD that a lot of people get placed.
Yes.
So if we do have a kid that comes from an outside country, once they come here, we do make sure that they have a TB test to make sure they haven't been exposed or they're not actively ill, so we can then treat them appropriately.
Yes.
The only time you'll see a lot of kids that need that here in our country, they're born in the U.S., is when they're older and maybe they're going for employment and they're working at a nursing home or residential facility or have a job at a hospital or in healthcare. They will be required to get a TB test, and all of us in healthcare have to get one every year as well.
So we talked about the 4-year-olds or the 3-year-olds being immunized. How about what if the child is going into middle school or high school? Is it different physical for that?
Well, the physical exam is just a physical exam. We've got a standardized paperwork form that works for pretty much every age. But there are different immunizations you need once you get older. And so the kids, I love to tell the kids, once they get their 4-year-old shots, the ones for kindergarten, you're good to go until right before 6th grade. And the big ones that really occur for the older kids is for 6th grade in New York State, you're required to have your tetanus booster. Usually that includes a pertussis component in there, so we call it the Tdap. You need that for 6th grade. You need the first of your meningitis vaccinations for 7th grade. We usually bundle those and give them both at the same time. Like, why have you come in for one shot this year and one shot again for next year? Let's get them both in while you're here, so you're good to go no matter what for both 6th and 7th grade. For 12th grade, you're required to get the second of your meningitis vaccinations. And so there's 2 of those meningitis vaccines required, one right before 7th, one right before 12th grade. And so and that tetanus booster I told you about for 6th grade. So those are the required ones. We also do recommend the Gardasil, the HPV vaccination, which is the one for the prevention of cervical cancer and certain kinds of warts. And that's not a requirement for the school, but the American Academy of Pediatrics Centers for Disease Control recommend that one. Parents, I always pick my battles. I want you to make sure you've got the things that you need for school, but we will discuss the ones that we definitely recommend.
That's and to enter school, you have to then show documentation that you've had these vaccinations.
Yes, indeed.
Mm-hmm.
Yeah.
Well, meningitis. Could you just explain again, what is meningitis? I forgot. And there might be other listeners who forgot also.
Yeah. The short version is the type that we're protecting you against with vaccinations is a bacterial organism that once it gets into the body system can spread through the entire system, causing what's called a sepsis, and have a lot of issues with both clotting, it can also get into the brain and affects the nervous system. Very, 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 very bad thing. We do not like it. You can have some pretty bad complications from it, both neurologically, but also to your cardiovascular system, especially to your blood vessels and to the distal parts of your body, your fingers and toes, your feet and your hands. So we're very, very, very much against that organism. So we like to try and protect people against that. It's not that it's something you see, oh my God, there's 12 million cases a year of that. But when you do have it, if you're not vaccinated, it can be rather devastating. I actually had a we knew people way back before we had the vaccination that would have many severe complications about that. We get concerned about this organism because the reason why we give those vaccines at those ages is that's when we tend to see the peak of infections for that. We know that meningitis tends to spend a lot of time spreading in areas where people spend a lot of time together, enclosed together a whole lot of time. So college dormitories, military recruits, schools where people are in the same time, in the same place with the same people over and over and over again. So just like a common cold can spread quickly amongst a classroom of students, this is something that we want to make sure we're preventing, because if it can spread, it can be contagious, it can cause problems. We do not see a lot anymore because we really have been vaccinating. There are some viral types of meningitis, which is a different scenario, something different entirely, which doesn't have the same type of complications or concerns that we worry about with the bacterial one, because the bacterial one spread can happen within the matter of once you're infected, and if your body's going to be more severely affected, it can progress within 24 to 48 hours to a very severe illness, and that's why we really want to make sure people are protected against it.
Yeah, and listeners, remember, we just want to make sure that your children, your grandchildren, your foster children, the children in our community are safe. That's why we talk about the importance of vaccinations, because we're just looking out for not only your safety, the safety of our community. Another vaccine that I know is coming out soon, within the next few weeks, is COVID. Its vaccine is coming back again. What are your thoughts on children getting the latest, the most current COVID vaccine?
As a pediatrician, we recommend it for all those, especially folks that we feel might be at greater risk. So that might be the kids that have a history of recurrent respiratory illnesses, like your asthmatics, like kids that every year they're getting a respiratory virus, kids that do live with folks that already have a compromised immune system or a little bit older. So it's sort of like the same way we look at the flu shot. You get the flu shot not just to protect yourself, but to protect the people around you. And don't sleep on it. COVID is still around, people. It's still there. It's still less than fun to have. Okay. And that leads me a little bit, and I want to tangent just for a hot second, where I talked about kids that have pre-existing illnesses. A really good thing and a very important reason why you need to go back to your doctor before school is if your kid does have any kind of condition where they have to take medicines at school, potentially asthma, potentially something like ADHD, say your child's a diabetic. You want to make sure that you have the most, a recent prescription, your doses are all up to date, and the appropriate medication at school form, so the school nursing office, A, is aware of the child's condition, and B, has the appropriate orders and times and needs for the doses for that medication for your kid for school, so it's on file and up to date. The classic scenario is a little kid that's got asthma. Maybe they don't flare up all the time, but I'd rather them have that available in the nurse's office and sit there all year than all of a sudden they're wheezing after a gym class, and they don't have it available, or they can't give the medicine because, we don't have the order from the doctor's office. So we always want to make sure if your kids have any kind of medical conditions that require treatment, that we're up to date on it, we're optimized for their treatment, and we've got all the paperwork they need and the prescriptions they need for school. That's one of the biggest things we make sure is taken care of during these school checkups, these school well visits prior to the kids starting school.
And I also want to at this point make a mention, and I know we had a program on it a few weeks ago on the school-based health centers. So if your child does have a chronic condition, or you're concerned that they are getting these reoccurring colds or asthma flare-ups, you may want to look into the Kaleida Health school-based health centers that are part of the Buffalo Public School system. So I just had to mention that.
That's actually a good plug, because I work with several of the nurse practitioners in those schools and in those programs, and they're well trained and know what they do. And if the kids have an issue, they know how to handle it. They know who to call, get advice on if it's beyond their scope of practice, to make sure the kids are taken care of. Mm-hmm.
Yeah, and your child will receive that treatment every morning. You don't have to worry about it. I've seen that firsthand when I used to work, obviously with Kaleida, but I used to work closely with these school-based health centers. It's amazing. It's a clinic right there, 24/7. And Dr. Archer, when you talk about family members with health conditions. What if someone has rung the bell there, cancer free? Does that person, child or adult, are they still considered to have an immune system? Even though, I mean, immune system, are they still considered to have a weak or weakened system, even though they are cancer free?
It's not so much an issue if they have a weakened system. That's something, and I'll be perfectly honest, that's something that you would want that person and their oncologist and their primary to determine from the appropriate labs and everything. Where is your immune system right now? If you're cancer free, that means the cancer's gone. Has your immune system rebounded from all the treatments and things? And so you always want to make sure you've got some caution with that. If someone is officially cancer free and they, that bell has been rung, awesome. But also have appropriate precautions. If you've got a runny nose around someone that just cut over cancer, put on your mask. Respect your fellow human beings. You lose nothing by putting your mask on if you got a runny nose. And that's the thing right now. I know that people are all on about masks and I shouldn't be forced to wear a mask. I love the fact that people wearing a mask is a sign that, like, yes, I'm sick, but also I care enough about you to make sure that you're not getting sick elsewhere. It's really less about, oh, what's in this for me, but what's in it for me and my fellow human beings that I'm hanging around on this planet with. So as physicians, we are always thinking about, oh, let me put that mask on to protect the other people we're around. Or if I'm going into a room where we know the child's, they came in with a runny nose and they're coughing and sneezing, I want to put on that mask so the next patient I see after them, I'm not handing something off to.
Yes.
All physicians are washing their hands. We've always been good about that. We're washing our hands and gloving up. But the mask thing, we are still conscious of that fact. And I love going through, going out in the street, going out to the store, going out to functions and seeing people wearing a mask, because that tells me they're looking out for their fellow citizens. And I think that's a good thing. And if people are or they might be uncomfortable. They might feel, you know what, I'm going out to the mall. I want to make sure I'm protected just in case. Do that. And if somebody says something, you tell them, well, this is my business. You keep your business over there. Keep it moving.
and you know what, Dr. Archer, we have run out of time again, believe it or not.
Oh, it's not surprising. Not with you and me, friend. Not with you and me.
So on that note, I want to say, Dr. Fred Archer III, thank you again for part 2. And thank you again for being our guest this morning on the Great Lakes Health radio program. And listeners, I want to thank you especially for listening to the program. My name is Francesca Messiah from Kaleida Health, Manager Workforce Development. And next week, you will hear from my esteemed colleague, Cindy Bass from ECMC. And remember, if you're thinking about a new career, thinking about a new job, please visit our Kaleida Health website. That's KALEIDAHEALTH.org. Click on careers. So until then, 2 weeks, stay safe, be well. Bye-bye.